Good afternoon. I'm very pleased that we are joining here at the webinar. Today we will give just maybe 1 or 2 more minutes for later comers to join, and then we will start. So please be patient for 1 or 2 more minutes. Thank you. So once more, good afternoon, everybody. A warm welcome to all of you participating in this webinar today that is organized by Health and Environment Alliance. We are an alliance of over 90 organizations from the health community that are working for better health through a healthier environment. I'm Vlatka Matković. Probably many of you I already know. I'm a senior policy officer at HEAL, and I will be chairing this webinar for that the topic is the green agenda for Western Balkans and healthy recovery. So we will touch upon green agenda and recovery in relation to health. And today I'm joined with my team, Anne Stauffer, our deputy director at HEAL, then Serjan Kukol, he is consultant on health and energy for Western Balkan region specifically, and as well Elke Zender, he's HEAL's media coordinator. And I'm delighted to see you joining our webinar that is focusing on green agenda for Western Balkans. As some of you have participated already to our previous 2 webinars. This is a series of webinars that is focused on specifically Western Balkan region. But we have so far many other participants from other countries that are following the region, and also participants from around the world, not just Europe. And I'm very happy to see you again here. If you would like to share in a chat where are you currently sitting at, which country, so we kind of get a little bit of overview from which region you are coming, and maybe if you could share as well for in which field you are working on. So we also have a bit of idea what topic does interest you the most. So hello, Maria from Serbia, and I know Maria is working for Public Health Institute. Kale from Ireland, also public health. Very happy to have you here. Branislava from Serbia, air quality, chemicals, and climate change. So as I mentioned, the webinar today is the last in our series of exchange. First one was on air pollution, then followed by climate change, and all focusing on Western Balkan region. With this series, we are responding to the increasing interest in Western Balkans. So the region is coming to a focus of many people, and health sector is rising their voice in the region, but also about the region. So we have been listening about health impacts of air pollution so far in our first webinar, and then afterwards impacts on climate change and how it relates, or how does it bring about in Western Balkans. And today we will be seeing or hearing from our speakers about green agenda for Western Balkans and what international health community or local health community has to say about this. And with this, I would start just to give you a brief background. European Union recently has placed high hopes on the green transition in Western Balkan region for next decade. And it is outlined in an economic and investment plan for the Western Balkans. And also there are guidelines for the implementation of green agenda. So from health perspective, greening the Western Balkans and addressing the unacceptably high pollution in the region is absolutely urgent and will bring many benefits. We are trying to highlight this over and over again. Those include reduced rates of cancer, heart and lung disease, improvement for children's healthy development, and advancing on carbonization will also contribute to boosting people's health overall and increasing health resilience, which is key in consideration in preparing for any future pandemic. The green agenda for the Western Balkans offer unique opportunity for greater health protection and improvement. And it's also a response to the unprecedented COVID-19 pandemic, which will cost Balkan region dearly. We saw already impacts in the Balkan region as well as worldwide. So HEAL is working in identifying those measures and investments that will achieve basically a triple win. So protecting health on one side, then tackling climate change, and as well reducing pollution. So as you can see, there is a lot to talk about, really burning issues, and I'm very pleased that we here have exchanged with our very experienced and well-known speakers, and as well you participants. And before maybe I start, I would like to announce just a few housekeeping rules. So there is a translation for this webinar. It says translation button French, but actually it's Serbian. We are unable to change this in Zoom for some reason. So if you would like to listen to the Serbian version of this webinar, please click on French. Questions you can post in question and answer box or chat, whichever you prefer. I will be monitoring both, so yes, please do pose a question during the meeting in one of those boxes. The webinar is being recorded, both Serbian and English versions, and later on we will add this to our YouTube channel, so you can either forward the link to interested people or check it out yourself again. And if you have any technical difficulties for Serbian participants or for Serbian language participants, please contact Serjan in a chat, private chat, and for English one, you can contact Elke, that both are in a list of presenters. And with that, now I would like to give a floor to our first keynote speaker, Guillemette Vachey. She's a policy officer covering environment and climate change in the Center of Thematic Expertise on Connectivity and Environment of DG NEAR, so European Commission's Directorate General for Neighborhood and Enlargement Negotiations. She's also a chapter desk for enlargement negotiations on environment and climate change, or as we call it, Chapter 27 of EU Acquis. So please, Guillemette, you have 10 minutes for your presentation. the floor is yours. If you could share your presentation.
Yes. Thank you very much, Latka. Allow me just to switch off my camera because I just been interrupted once, so I prefer to give as much space for the bandwidth as possible. So I will just switch it off and then share my presentation with all of you. So I hope you can see it.
Perfect. If you could put it full screen, that would be even better.
Yeah, okay. So that I'm to.
Yes,
there. Okay. I understand.
No. A little bit on the left side. If you move next to it. No, on the yeah, that one.
Okay. Thanks. Oops.
Should work.
Voila. Okay. Here we are. All right. Is it fine like this?
For me, it doesn't show.
Now?
Now, yes.
Okay. Perfect. Just a little bit of time. All right. So thank you very much, Latka, for the introduction, and thank you very much to Hill for the invitation. It's really a pleasure for me to walk you through briefly on the Green Agenda. Just to say indeed that I'm not a health expert, but focusing on environment and climate with indigeneia, as Latka explained. But still, I trust this general introduction on the Green Agenda for the Western Balkans will be useful for you. And I will try to speak not too fast for the interpreters. So on the Green Agenda for the Western Balkans, I just would like to stress first that it's not new and that it builds on several previous steps that were taken in 2019, actually. And the main one being the Clean Energy Transition Statement that all ministers in the 6 Western Balkan countries, from ministers of energy and ministers of environment, signed. So that was in February 2019, and Hill was actually participating to this seminar or event, where basically we had the first acknowledgement from the region at the highest political level that a clean energy transition is needed. Then the Green Deal came out in December 2019. And of course, I hope it's not the first time you hear about it, but basically, just to summarize it, it's really the EU answer to the Paris Agreement, but it also goes much beyond. It's really the new growth strategy of the EU, which will help us cut our emission while creating jobs. And the idea is really to turn climate and environmental challenges into opportunities. So this is also a very positive strategy to focus also on growth and jobs. In the context of the COVID-19, of course, it became, the Green Deal was even more central to our EU policy because it became also central to basically the recovery plans of all the member states. But what is basically the link between the European Green Deal and the Green Agenda for the Western Balkans? Let me stress briefly 3 points to understand this link. So first of all, each Green Deal initiative, starting with the Green Deal itself, does entail an international dimension. Whether it's a farm-to-fork strategy or circular economy action plans that you might have heard about, or climate law, basically all Green Deal initiatives which are already adopted or to come, they are setting a strategic framework for further rolling out EU policies or legislation internally in the EU, but also for EU to work together with its partner. Indeed, there can really be no effective green transition for EU without its neighbors being fully on board, and that at the earliest stage as possible. So one of the reasons is that our economies are interdependent, but another one is that climate change and pollution don't stop at the EU border. This is all the more relevant for the Western Balkan countries, given their European perspective, which has been recalled and repeated recently in many high-level events. I won't expand on that, but this perspective, this European perspective for the Western Balkans really implies also commitments to align with the evolving EU acquis, as well as the 2030 agenda and the Paris Agreement. So it's true that all the direction of EU policies linked to the Green Deal are critical for your own action in the Western Balkans. And that is the reason why the European Green Deal makes really a clear reference to the preparation and implementation of a green agenda for the Western Balkans. And that's what you can see on the slide, which is basically an extract of the Green Deal roadmap, where 47 actions are listed, and one of them is the green agenda for the Western Balkans. Now, what is the rationale behind the green agenda for the Western Balkans? Of course, we need to take into account that the starting point of the Western Balkans is different in terms of many aspects, be it access to financing, be it energy security, or all aspects of the Green Deal start from a different starting point. And indeed, the objective was to therefore adapt the initiative of the European Green Deal to the realities and to the specific needs of the regions. For example, it's very much acknowledged now by many studies that the region is going to be affected much more than the global average by climate change. How did the Green Agenda materialize, basically? Well, first of all, the European Commission put forward a staff working document that Violeta was mentioning in her introduction, which was really designed in cooperation with a lot of key services, DG Energy, DG Climat, but also DG Santé and DG Agri for the farm to fork aspect. Just to explain here briefly that the farm to fork strategy is really the indeed joint Agri-Santé initiative from the Commission to improve all the aspects of the farm to fork chain, so improving agriculture and also food and make them greener, to simplify a bit. But then basically what is also important is to mention that the Green Agenda was shortly after it was presented by the Commission, it was endorsed at the highest political level within the Berlin process at the Sofia summit last November. So this, the fact that we had, the Commission made a proposal and the Western Balkan leaders endorse it very smoothly, I have to say, I have to confess, is really a good sign. It really shows that, first of all, it's not an agenda from Brussels, it's really an agenda owned by the region. And it also shows that there is a momentum that is created with this Sofia declaration. Then two features I just would like to briefly mention here on the Green Agenda is that it is really a positive and multi-beneficial agenda. So the idea is really, like for the Green Deal, to turn environmental and climate challenges into opportunities. And of course, it goes much beyond just what the Ministry of Environment is doing. It also requires involvement of all the relevant ministries, be it the Ministry of Energy, Ministry of Transport, but also Ministry of Health, of course. And what it is important also to stress is that the Green Agenda is listing concrete actions, both at regional and national level, that indeed the leaders endorse through the Sofia Declaration. So a kind of major achievement that I can stress here is really that, for example, Western Balkan leaders committed to climate neutrality by 2050, which basically gives the same ambition and the same direction of travel than in the EU, even if we know that the journey will be different and more gradual and more adapted, the ambition is the same. And there are also other actions. I will not list all of them, but just to explain that they've been basically grouped into 5 main pillars, which reflect the 8 transformative policies of the Green Deal. So we have a first pillar on decarbonization and resilience, which basically look at climate, transport, and energy policies. So also where emissions, most polluting sector of transport and energy, and how to cut emissions. A second pillar is basically on circular economy and how to address particularly waste and move from a linear to a circular economy in many different sectors. Look at more recycling, more sustainable production, and more efficient use of resources. A third pillar is on biodiversity, and of course the aim is to protect and restore the natural wealth of the region, which is very high. Then we have a fourth pillar, on depollution, and here we look at aspect on air, water, and soil. And finally, a fifth pillar on agri-food measures, which aims at reflecting the farm to fork strategy. So basically looking at how to have more sustainable rural farming and food and agro-industry, let's say. What I will now just focus on is basically the depollution and the decarbonization pillars, because they are the most linked to the health sector, although the 5 pillars are of course linked to the health sector. It's just being conscious of the time. I need to focus on. I mean, I choose to focus on those two. But just to start briefly recalling the main challenges on the pollution in the region. I guess you already heard about it through the previous webinars. But to recall indeed that the air pollution is one of the highest in Europe, with really some let's say worrying threshold in terms of PM 2.5 and PM 10. Also some striking figures on the number of premature deaths, which is around 32,000 per year for a population of 18 million, which is quite a lot. And indeed, as the HEAL study mentioned a few years ago, the fact that the 16 power plant in the region emit much more sulfate dioxide than the entire fleet from the EU, which is around 250 power plants, is also a really striking element. But also what needs to be added to those figures is indeed the fact that this has a significant cost on the economy, on the healthcare system, in terms of loss of productivity, and another consequence, which is sometimes less obvious, but still it also contributes a lot to immigration of the youth. Basically, it's a contributing factor. I will not enter into detail of the figures on in the little table that you can see on the screen, but it's basically to show how the cities are badly ranking in terms of pollution, which is really striking. Now focusing on, after having a quick look at the challenges for decarbonization and depollution of air mainly, just to give a few examples with a slide on what the Green Agenda put forward, keeping in mind that, of course, there is also a part of the Green Agenda, at least the documents presented by the Commission, on ways to implement it and ways to finance it, on which I will not expand. But here I wanted to indeed give some example of concrete actions that have been put forward and to which Western Balkans leaders agreed to implement. First, so on air, so the Green Agenda for the Western Balkans proposed that the Western Balkans develop air quality strategies to have an overarching framework to tackle the issue of poor air quality. That best available techniques linked to the Industrial Emission Directive are better deployed. Also that the monitoring infrastructure, which is really key, indeed to get the right data and then feed in the policy making for both air and water are modernized, are also maintained, which is an important point in the region. And then the final example on this depollution part, the Green Agenda foresees the possibility to have specific regional protocols on air and water pollution. And now on the decarbonization pillar, that's the second paragraph. As I mentioned, one of the major achievements of the Green Agenda for the Western Balkans is indeed this headline goal of climate neutrality by 2050, which has been enshrined in the EU in the climate law, and that the Western Balkan leaders also endorsed, so the Sofia Declaration. The countries are also invited to put in place some carbon pricing mechanism towards the emission trading scheme. Of course, to develop renewable energy production, and also to increase energy efficiency in notably through the framework of the national energy and climate plans. That's a bit of jargon, but that's basically what the country needs to do in terms of effort to reach some climate targets by 2050, and they are helped by the energy community on this. The Green Agenda for the Western Balkans also foresee a renovation wave, so basically enabling better energy efficiency of buildings, similarly to the renovation wave which is foreseen in the EU. And finally, there's also Coal Region in Transition Initiative, which is a part of the Green Agenda, in order really to help the countries moving away from coal and exchange best practices on reconversion of some regions. So that was a bit a list of few examples, but of course, yes, the Green Agenda goes much more beyond that. And as I said, there's a lot of other aspects on the way to implement it and to finance that. I invite you to look at the staff working document on the Green Agenda itself if you are curious to learn more. But yeah, I will also potentially address some of them in the discussions that I'm looking forward to. But just as a word of conclusion, to say that indeed we are not naive, and we were fully aware that the green transition will not happen in one day, and that it set a quite ambitious bar for the regions. But the EU is really, so really the Commission and the Member States are ready to support the region in this end, and it's also our joint responsibility for future generations. So with that, I will give back the floor to you. Thank you very much for your attention.
Thank you very much, Guillemette. It's always very striking to first see the pollution chart for Western Balkans, but then again, really pleased that there is ambition agenda for Western Balkans, and within Western Balkans some movements are being made. But please now let me introduce our next speaker of the webinar today, and this is Dr. Jarosińska Dorota. She's World Health Organization Collaborating Center for Air Quality Management and Air Pollution Control. Dear Dr. Jarosińska, please join us in this discussion and present us a WHO manifesto that is aimed at facilitating the healthy recovery. So please, the floor is yours, and welcome. If you could share your screen, that would be great.
Yes, of course. I hope you can see it now. Is it okay?
We see it, yes.
Okay.
Full screen, yes.
Perfect. Thank you very much, Vlatka. Good day to all participants. My name is Dorota Jarosińska, and I work at the WHO European Center for Environment and Health. And I would like to thank you very much for this kind invitation to complement the discussion on the green agenda for the Western Balkans, focusing on the health aspects, and mainly to present the WHO manifesto on the healthy and inclusive recovery. And when we talk recovery, we mean mainly recovery in the post-COVID time. Of course, the need for the green, healthy, inclusive development has not been born with the onset of COVID, but this dramatic global public health challenge has exposed a number of vulnerabilities, and also has reinforced the urgent need to really do better in the future. So let me very briefly start from referring that this unprecedented challenge of COVID-19, in addition to the very impact of the disease, had many wider impacts, societal, economic, and we have been focusing on addressing environment and health dimensions through working with experts, with member states, producing a number of documents and guidance and hints that we hope have been useful to member states to take prompt action. In the course of the past year, we, among other activities, organized a number of events, webinars, looking into different environment and health considerations relevant for COVID, be it related to water, hygiene and sanitation, or chemicals, or the issue of contaminated sites, urban development, mobility. So this was more a response to this new challenge, but already addressing this environment and health considerations. Because this new situation of COVID has on one hand brought forward some environmental challenges, but it also demonstrated few changes. And as I mentioned, it already reinforced the need and this commitment that we really need to do better in the future. We need to build forward better. I'm sure that we are all familiar with this information about the short-term changes in environmental quality that were associated and demonstrated following the lockdown measures with locally reduced levels of noise, levels of air pollution, especially these related with transport. So these were the signals that actions have effects. But then, of course, the key question is, can we maintain, can we do better when we are restarting the economic, social life following the pandemic? And this was the main, I would say, prompter for formulating some prescriptions and also some points for action to ensure that this recovery, that the future development is healthy, is green, is inclusive and equitable. And this manifesto focuses on 6 domains: protecting and preserving nature as the source of human health, investment in essential services, energy transition, more healthy and sustainable food systems, healthy, livable cities, and also some economic fiscal instruments to move away from toxic subsidies. So when we look at these 6 points, it is apparent that there is a large overlap with the priority domains also of the Green Agenda for the Western Balkans. So this identification of the areas for action is the same, and it is great to see that many of those components that are critical for this healthy recovery are also at heart of this regional initiative. When we talk about protecting and preserving nature, this is something that on one hand seems obvious and well understood when it comes to the relevance for human health, but on the other hand, quite often seems too far, too remote. when we talk about maintaining or reducing the pace of change when it comes to biodiversity, still quite often this is seen as something external to us. Oh, some species are disappearing. What a pity. We don't see this bird, we don't see this plant. But this understanding of the critical relevance of biodiversity as one of the key conditions for ecosystems to be stable, to be resilient, with the implications to human health, this definitely needs to be reinforced. When we talk about preserving nature, it's not only about protecting species, but it's also about addressing those elements that are critical for it. So if we cannot preserve biological diversity, if we don't target climate change, if there is a situation of droughts, flash floods, temperature changes which are affecting vegetation. It's also how we handle big human settlements, whether we have sanitation systems in place, because uncontrolled discharges of huge amounts of untreated wastewaters, they will have impact on the nature, on the quality and functioning of the ecosystems. So the understanding and action to protect the nature as the precondition of human health is one of the actions that we need to take, or we need to reinforce and strengthen, building on the initiatives already in place. As a kind of a reminder of these interconnections between nature, biodiversity, and health, and if there is a need to empower professionals on the health relevance of these interrelationships, I would like to mention one of our recent publications, really targeting this interface between health, nature, and biodiversity, which contains these, on one hand, obvious messages, but on the other hand, messages that still need to be conveyed, that nature, meaning intact, resilient ecosystems, provide basic conditions for human health and well-being, and that good quality environment protects our health, and vice versa, different pressures on the natural environment threaten human health and well-being through different ways, directly because of the environmental change, but also may have far-reaching indirect consequences when environmental degradation has these impacts on economy, on societies, including conflicts, migration, and challenges related to this. Another domain for action, another prescription, is to invest in essential services. It is a quite sad reminder that globally, but also in different regions, there are many places where people are lacking essential services, to wash hands, to have basic sanitation. This graphics is presenting the global picture. 40% of households around the world lacking hand washing facilities. In Europe, in our region, the situation will be better in this sense. But also in our region, for example, more than 36 million people are lacking basic sanitation services in their households, schools, etc. So this prescription is a very important reminder that improving the quality and access to essential services in households, in schools, and in healthcare facilities is crucial for the further development and for better recovery. In this context, I wanted to highlight a campaign which was also part of the campaign this year at the occasion of the World Hand Hygiene Day on hand washing. And again, I picked up this example just to remind us that these apparently simple, trivial, basic measures, these are still things and services which are not available to all. So investment in these basic essential services, creating conditions for them, still remains a challenge and a need for action. Another prescription, energy transition. We already have heard of it, and I believe that in this community we do not need many explanations what does it mean and why this energy transition is needed. And here I would like just to stress and to use an example of the event that was organized a month ago. It focused on one of the countries in the region, on Serbia, and this was a joint undertaking of a range of UN agencies under the umbrella of the Regional Issue-Based Coalition. And of course, one webinar, one event is not changing the world, but I wanted to stress here the following point, that quite an effort was made to get the topic really focused. And the focus was on household air pollution. And again, also quite an effort was made to get together a wide range of UN agencies who worked together to present to colleagues in the country, in the UN team in the country, a kind of a panorama of what kind of services, skills, knowledge different partners can offer to enhance actions towards transition to clean energy, targeting this particular aspect of air pollution. So here I just wanted to stress this issue of intersectoriality and a need of consequently building on existing initiatives and exploring existing synergies. The next one on more healthy, sustainable food systems. It's a huge topic in its own. I will not go into the details for the sake of time, but again, you will hear in these keywords connections also with the other domains, because healthy, sustainable food systems, it's not only about ensuring access to good nutritional value food, but it's also how the agricultural system functions with impacts on water, land, the profile of food production, moving away from meat more towards plant-based diets. These are huge challenges, but constituting one of the pillars on which this future development needs to be based. Another domain, cities. Again, I believe that in this community, we do not need big arguments to convince why healthy, sustainable, livable cities are crucial for healthy green recovery. Again, there are many dimensions, from urban planning, land use planning, through measures targeting transport, built environment, housing, preparing green and gray infrastructure for climate change. So there are many actions that need to be taken and which are being taken by the cities. And again, here I would like to use just some examples to illustrate, to reinforce the relevance of green and blue spaces, good quality, accessible green and blue spaces. We working with the experts are about in the coming weeks to publish a document summarizing the new evidence and perspectives for action focusing on mental health. And this, even though it was planned earlier, this type of document and considerations get even more, we believe, relevance in the context of COVID-19 and requirements. Speaking about transport, I would like to use an example of the high-level ministerial event under the umbrella of the Transport, Health and Environment process, which again looked at building forward better in the transport domain. And for the first time, this forum has put forward the first European master plan for cycling, giving a strong signal that this move towards non-motorized transportation is an important contributor, not only from the transport perspective, but also health and environment. And then finally, the huge domain of the fiscal instruments and making sure that in the future, the taxation mechanisms are revised in order to support and promote measures and actions that are beneficial socially, for the health and for the environment, and that subsidies and fiscal instruments supporting fuels that are polluting, meaning damaging to human health, are not strongly supported. So with these prescriptions and very few illustrations of actions, I would like to conclude and hope that many of the actions that are planned to be undertaken under the umbrella of Green Agenda for the Western Balkans, they will deliver also health benefits and will contribute to the prosperous development of the region. Thank you very much for your attention.
Thank you very much, Dorota. That was absolutely wonderful manifesto touching on so many dimensions, and it's basically really crucial document for health community, but also anybody who works in a policy making public domain, that actually really we have a healthy prescription for so many different topics, from urban environment and health. I'm really glad to see also mental health in it taking part soon. And last but not least, of course, energy transition. And this is one of our recent focuses that need really urgent action, and it needs to happen now to improve health globally, not just in the region. And with that, I would like to introduce our last but not least speaker, Violeta Gordelliwicz. She is Health and Climate Change Coordinator in HEAL and leads HEAL's work on air quality in cities. And she's a lead author of Hidden Price Tags, or How Ending Fossil Fuel Subsidies Would Benefit Health. So this is a report published in HEAL. So welcome, Violeta, the floor is yours.
Thank you very much, Vladka, and I'm very happy to be here today. Let me just share my screen. So that should be fine now, correct?
Yes, very good.
Great. So I'm very happy to be here today and to touch upon the role of government subsidies in fueling the climate crisis and in health. Dorota already touched upon it in her prescription number 6, but I would like to take my presentation to go into a bit more detail and to look at what it really means going forward in the recovery, but also in general in the Western Balkans. So I'm going to kick this off by reiterating the obvious, as I think it will help us see why any public financial support for oil, coal and gas is a bad idea. And the obvious is the science. So multiple studies and international bodies, including the UNFCCC, have determined that fossil fuels must stay in the ground effective immediately if we are to even have a shot at reaching 1.5 degrees global warming. Yet, according to many of the same reports, the world is heading for about 3 degrees at best. So you would think that that alone would mean that we would do anything in our power to end the burning of fossil fuels, and that it is an absolute no-brainer to stop pouring any more public money, any more support into an energy source and into an industry that is considered the main culprit of man-made climate change. However, that's not the case. And I'd like to take the next minutes to tell you a bit more about why fossil fuel subsidies are counter to the very climate action that governments have committed to in the Paris Agreement, and then to dig into some numbers from that HEAL report that Vladka mentioned. Let's start with some basics. It's actually quite difficult to track fossil fuel subsidies because there is no universal definition. So institutions, governments often estimate subsidies using their own approach, which complicates things, as you can imagine, and it makes it incredibly difficult to hold governments accountable and to compare even. However, in most banal terms, subsidies to fossil fuel companies can be considered any government action that lowers the costs of producing coal, oil, and gas for energy use. So this can be direct payments, it can be via tax breaks, it can be loans that are given by the state, and many other ways, in fact, but the result is always the same. So governments encourage more fossil fuel use than would otherwise occur. Now, given that for years, as you all have probably know and have come across, we keep talking about how, we just need to have the market take care of things and renewable energy will get cheaper and then governments will start using it. If you look at the effect that fossil fuel subsidies have, you quickly see that they increase the price gap between fossil fuels and renewable energy sources, and therefore making fossil fuels appear cheaper, increasing their production, and ultimately, therefore, decreasing the incentives of producers and of governments to ultimately switch to renewable energies because they're just too expensive. Now, globally speaking, fossil fuel subsidies far exceed government financial support for renewable energy sources. I don't have a number for 2019, but I do have one for 2017, and there it says that it's almost 20 times more than what governments provide for renewables. And if you just think about that, knowing the situation we're in, it's disturbing. It just does not make any sense. But what does this have to do with health exactly? So, whereas it's obviously bad to spend taxpayer money on something that is not compliant with climate action, subsidizing something like fossil fuels also has a direct and immediate impact on our health, an immediate cost to our health. Put simply, when we subsidize coal, oil, and gas, we are paying once with our taxpayer money, and then again a second time, and this time a much larger sum, for the resulting health costs from burning fossil fuels. And these health costs come primarily through the fact that burning fossil fuels causes high levels of air pollution. Both previous speakers have touched upon air pollution and have cited some numbers. We heard almost 400,000 premature deaths associated with it in the EU, but also we know that about 4,000 deaths are associated with coal power plants alone in the Western Balkans. So studies show that it has a significant contribution to respiratory cardiovascular disease, but also that it seems to be impacting our brains, our nervous system, our reproductive system, and possibly even our immune system. So this new science keeps emerging and it's all pointing in the same direction. Now, these impacts, these social costs to our health and costs to health systems are in economic terms labeled externalities, as many of you probably know. They are the consequence of our energy use that is not being reflected in market prices. But that's exactly where the problem lies, right? So these costs to health and to the environment are not reflected in the price of coal, oil, and gas. But it very much does cost us, as we established. It costs us in our health, it costs us in environmental degradation, it costs us a safe climate. And the fossil fuel industry is not the one paying for these consequences. It's local communities, it's people overall. Usually the same people who survey after survey we know demand climate action from their governments. So whereas in some parts of the world, you might now say, you know, subsidies are a good thing because they ultimately reduce the costs of energy for people. And that's surely the case in the Western Balkans. In fact, what they do is that they simply distribute the costs in a different way, making people pay with their health, often without realizing it. I would claim, and I don't have a number to back that up, unfortunately, but I would claim that most people are not fully aware of how much of the taxpayer money their governments are spending in subsidizing fossil fuels, while at the same time having this public narrative of supporting renewable energies and the green transition. Now, in 2014, so a while back, the IMF, so the International Monetary Fund, published a big report in which it tried to calculate those externalities, so those costs to society. And it found that when these external costs to health and the environment were factored in, that then governments' support to the industry was more than 5 trillion, according to their research. And back then, when the comparison was made, that was more than all of the world's governments spent on health, just to put that number in perspective of the damage that's been done. Now, coming to HEAL's report from 2017. So we took these IMF numbers and we extracted the ones specific to health costs, and we compared them to the numbers of subsidies that countries gave that same year to coal, oil, and gas. Why did we do that? What was the purpose? Well, apart from believing that we must factor in the true cost of fossil fuels in order to make, you know, truly informed choices about the future of energy production, we also aimed to shed a light on the health opportunity that phasing out, ending fossil fuel subsidies would present. Let me share some of our numbers, just mentioning again, these are from 2017, but if we are being totally honest, not much progress has happened ever since. So these are actually still pretty close to what's going on. We looked at the G20. So we did not look at the Western Balkans, but I'll come to that in a bit. And our report revealed that on average in G20 countries, the health costs associated with fossil fuel use are over 6 times higher than the subsidies given. Now, what does that mean? It means that citizens do not only see the 416 billion euros, so the figure here is in dollars, but it would be 416 billion euro that G20 governments gave to fossil fuel producers that year, but that gift cost them another 2.6 trillion euros in health costs from premature deaths from air pollution mostly. Now, we looked at many countries in great detail. These are just some of them. And we see that in each of them, the costs arising from fossil fuel caused air pollution are multiple times the subsidy given. And that everywhere, therefore, subsidies fund disease, they fund global warming, and they fund huge costs to society. Now, but as I said earlier, our goal was also to show that a phase out, an end to fossil fuel subsidies, is a public health opportunity too. And this is where findings such as these ones came in, which basically say that, ending fossil fuel subsidies, as Dorota already mentioned, it would essentially prevent disease, decrease premature deaths, and free up huge amounts of money. There is some older research that I still think is very worth citing, which is the first bit of the slide, which says that had fossil fuel subsidies already been eliminated in the 80s, carbon emissions would likely be a third lower. because without these public handouts to the industry, fossil fuels would simply, they wouldn't have been able to sustain their profitable production the same way they had. They might have transitioned much earlier to more profitable options. So having numbers like these matters. There's ever since been more studies trying to look at what the potential impact would have been. And also studies at the very last bit of the slide showing that, that's actually from the IMF still, that eliminating subsidies whilst implementing corrective taxes on fossil fuels would also reduce a significant number of premature deaths, which as a result of what I said would make perfect sense as air pollution would decrease, right? But having numbers like these matters because they show that fossil fuels are not just some fiscal problem detached from human lives, but that fossil fuel subsidies have direct consequences of our use of fossil fuels, and therefore on the climate, and therefore on human health. So eliminating them truly matters. What is also of value in advancing the phase out of fossil fuel subsidies is to think and to talk about what could be done with this money instead. Because fact is, fossil fuel subsidies compete with other public spending. They compete with education, social protection, healthcare. And back in 2017, we put the sum of fossil fuel subsidies in perspective to other expenses, sometimes random ones, sometimes some that in that country at that moment would have made sense. And we basically here in the case of Germany, see that the 5 billion euro that back then in 2014 Germany spent on fossil fuel subsidies, it represents taxpayer money that is sufficient to provide, for example, 300,000 households with a solar installation, producing their own clean energy, as well as fund the transition for back then all of Germany's 15,000 coal power plant workers. So this money, once freed up, can help solve many issues, including a just transition. And Dorota just mentioned plenty of issues that many countries are still struggling with, which would greatly benefit from some additional public funds. Now, since the findings from HEAL's report do not include Western Balkan data, that does not change the fact that fossil fuel subsidies fuel disease, even in the Western Balkans, even today. And there is a report by the Energy Community from 2020 that's looking at Western Balkan countries, among some others, and it looked at direct subsidies to electricity generation from coal and lignite during 2018 and 19. And it found that electricity generation from coal still receives significant direct subsidies in Western Balkan countries. Essentially, from the Western Balkan countries looked at in this study, Serbia and Bosnia had the highest subsidies, with those in Bosnia having increased by 3 million in a year, and those from Serbia having decreased, but still remaining very high with no concrete end in sight. It's important to note that this is often money that is being directed and given to otherwise unprofitable and economically not viable coal plants that could, money that could be spent to promote, as I said, the energy transition, to make it one that's healthy, green, and equitable, as was mentioned before. So we really need to look at this as like this big pot of money that is essentially taxpayer given, and that's being provided for something that's not good for people. Now, coming slowly to an end and bringing this to today, to recovery from COVID, countries have an important opportunity, as we already mentioned many times now, to shift this money to clean energy and just transition measures. I think what's important here to remember, so I really want to highlight it, is that fossil fuels are not just coal. But that gas is no better for the climate and therefore for our long-term health than is coal. And that the solution to both climate change as well as air pollution is an immediate transition to renewable, clean, and not just less polluting energy sources, but actually non-polluting sources of energy. And cutting coal subsidies to use them for gas will not get us to 1.5 degrees, nor will it protect our health significantly. And it's really important that this continues to be reflected in any mechanism, including in the recovery funds. And that brings me to my last bit, which are 4 recommendations that HEAL has put forward in the Western Balkans. The first one being to apply a zero pollution conditionality for all green agenda measures. So only pollute what will not, only fund what will not pollute. 2, to align air quality standards with the WHO, with the latest science, because it's the science that shows us when levels become dangerous to health. So it's a science that we should respect and follow. 3, to adopt a binding date to phase out coal in the Western Balkans. That one speaks for itself. And finally, and I'm really, really happy that in the WHO manifesto, there is a clear call to end fossil fuel subsidies. Also, obviously, our recommendation and public financing for all fossil fuels, including gas. I'll end here. And I hope that, if anything, that the absurdity of fossil fuel subsidies came across, given the times we're in, given the threat we're facing, given the huge chunk of money that could be used for health promoting activities. So thank you very much.
Thank you very much, Violeta. That was absolutely even shocking. The numbers always, when we see how much there is investment in health or healthcare, health coverage of what's being polluted. So definitely there is a room for not to pollute or pay, but to stop pollution in general. And with that, I would open up the questions. And maybe first start with some of our questions to Guillemette. So we saw in your presentation, and in a way we know it's that Western Balkan region is more affected or will be more affected by climate change than its global average. So what could be done for Green Agenda in Western Balkans to really deliver on its ambition and come closer to what's being planned in Green Deal? We saw a really ambitious Green Deal. All forces are on that, but Green Agenda, it's still a really important document and plan for Western Balkans, though ambition is a little bit lacking what's being seen in EU. So what's your take on this?
Thank you very much, Vladka, and also thank you very much to Dorota and Violeta for the, I have to say, very interesting presentation. I took a lot of notes. On your question, Vladka, indeed, I mean, first of all, the Green Agenda for the Western Balkans came out last autumn, and I explained that the Western Balkan leaders endorsed it at the highest possible level, but it's true that now the main challenge is its implementation and operationalization, if I can say so. And of course, it will take time and not happen overnight, because as you were saying, and as also it showed in Violeta's presentation, I think that the key is, of course, the political will, and making sure that what has been signed on the paper last November really is really implemented through action on the ground. So, of course, from the European Commission perspective, we are using basically all the possible means to make sure that that the Western Balkan leaders do follow what they've been committing to. On that, just a parenthesis is that indeed also in the Sofia Declaration, there is a commitment from the Western Balkan leaders to decrease and phase out of coal subsidies. That I would still make, I will still make a differentiation between coal subsidies and gas, but that's maybe for later. But indeed, just as a parenthesis, it's also part of the Green Agenda. But I was saying that we try to use all the possible means, to deploy all the possible means on our side, and indeed to, as also Dorota was saying, to use what is already existing and work in synergies. So that really comes from highest political level. For example, yesterday there was the Berlin summit. So it's basically some EU member states, 9 of them, and all Western Balkans leaders meeting 2 times a year to basically discuss Western Balkans further integration in the EU. And at that summit, Germany announced that they will send a special envoy to the region for the implementation of the Green Agenda. So it might sound a bit symbolic, but I think it's very good that there is at least one central voice, or let's say envoy in the region to make sure that there is a kind of monitoring on the implementation of the Green Agenda. And then of course, the key points, and especially from my perspective as chapter desk following the enlargement negotiation, it's actually the implementation of the acquis, which is basically the Green Deal in a way. Of course, it takes a bit more time for the Western Balkans, because first of all, we need to produce all the Green Deal initiatives first internally in the EU, and then it comes to the region. But if the countries would first, would implement already all the legislation that they've been aligning with in the framework of Chapter 27 Environment and Climate Change, would already be, in a much better position than we are today. And then final point I would like to mention also for the implementation is, of course, to use what is already in place in terms of regional cooperation and regional organization. Violeta mentioned the Energy Community report. And I think there are, indeed, we really need to pay tribute to this regional organization, because it really, steer the process in the region for not only aligning with the acquis, but also indeed from a political perspective to try to change things. But of course, it's not always easy. And also the recent Transport Community organization, which has been established and will do the same for sustainable mobility, and as well the Regional Cooperation Council, which has been mandated through the Sofia Declaration to basically produce an action plan and put in place a monitoring system to implement the Green Agenda. So I know it's a lot about systems and means, but I think it's very important to present to you briefly the whole panel of means of action that we have. But as I said, for me, the 2 main points are indeed political will and also implementation of what is already there, actually. Thank you. Over to you.
Thank you, Guillemette. And actually, we have 2 more questions. I think they're directed at you, at least one from Tony Vidan, who is saying that there is increase in EU funding for green transition. Yes, we see that. And do you have any kind of knowledge if some of these funds will increase for public participation and monitoring? And the one from Kale on sustainable transport system. If you have any information, for example, high-speed trains really needed and would increase not just connectivity in terms of mobility people, but also moving to sustainable transport. So please share with us your knowledge about those questions if you have them.
Yes, thanks. Thank you very much, Violeta. In terms of EU funding, first of all, I will make a kind of a caveat here, because the IPA, so the Instrument for Pre-Accession Assistance, which is basically all EU public money going to the pre-assistance, so to basically to the countries covered by enlargement policy. The regulation is still not adopted, so it's still under discussion between the Parliament, the Council, and of course the Commission. So it's true, I'm not able to give any precise figures or things like that, and everything is a bit on hold, although it should be finalized before the end of the year. But in terms of public participation, what I can say is that, first of all, for the Green Agenda implementation, we really see a crucial role for civil society, for local communities and health community as well, to have this bottom-up approach and ensure that, basically the reforms, the necessary reform do have a good bottom-up basis. And that there is a kind of governance which enables those reforms to be successful. But that's, I guess, goes without saying in this audience. But on the support to public participation, we indeed have the civil society support facility, which is in place since 2009. And on which basically I'm not an expert because my colleagues are dealing with it. But if you want further information, I'm happy to provide it to you at a later stage. Or what I always recommend when I talk to participants in the Western Balkan region is really to approach the EU delegation in the capital of the countries, because they are really the interface between the Commission and you. So I think that's a good way to approach it. But otherwise, the civil society facility is one of our main ways to support civil society in general in the region through IPA funds. And then second question on sustainable transport. I mentioned the transport community, which is established since last year. So a bit like the energy community, they are working indeed on translating, let's say, or reflecting the sustainable mobility strategy, the latest one, which was published last December, if I'm not mistaken, in the EU, and which indeed look at how to increase the greening of transport through, as rightly mentioned, an increase in rail. And I know that, for example, there is a recent example in Serbia of soon a rail line which will be financed by a financial institution. But in general, greener fuels, more rail. There are quite a few flagship in the mobility strategy that we will try to replicate, let's say, in an adapted manner in the region. So that's really indeed under the radar. But for more details, I would, we need to basically look at the strategy itself. But I could, of course, forward it to you. And just to say, and to finish on that, that's also the director of the transport community at the Ministry of Economy's meeting last November. So head of the Sofia summit really had this motto that I found very interesting. And he was saying to basically all the ministries of economy in the region, rail, rail, rail. So I think it's indeed on the agenda, at least of the transport community, and hopefully in cooperation with the Western Balkans economies. Thank you. Over to you.
Thank you very much. Great to hear that. I'm actually also using a rail to come to Croatia from Belgium, and it's once you approach a region, it's quite difficult. But moving on to Dorota and seeing like maybe a little bit moving to health communities. So not only what kind of measures we have, actions, but really like how do we ensure that health community, and health community also in a sense of civil society, has a voice and is included in decision making. And I see also Uroš Rakic posted the question, how do we explain or justify building a new thermal power plant, so coal power plant in Germany? Yes, we don't justify this. It's absolutely scandalous that this is happening. So how do we ensure that really we have a science in decision making, and also science coming from health sector as well?
Yeah, this is a big question. I think it's really important that health sector is an integral part of the discussion, argumentation, and advocacy. So I would say there are elements of evidence, advocacy, and acting as an example. So the evidence, this is really to use different methods and tools that would allow strengthening the health argument. Many of you may be familiar with some WHO tools that allow us to quantify either the health impacts of air pollution or translate and explain the health and economic impacts of non-motorized transportation, or health gains through improved air quality linked with the reduction of greenhouse gas emissions. So these are the instruments which are based on solid methodology, which empower professionals or people who want to bring this argument in the discussion with other sectors. In addition to advocacy, to raising awareness of the health implications of of pollution, but to bring hard numbers, to show the numbers how much health gain you can achieve through certain measures related to transition to clean energy, improvement of air quality, promoting cycling versus new nice highway running through the city center. These arguments that people who are putting forward health can use when discussing with city planners, with decision makers at local or regional level. And there is also a component, if I think of involvement of the health argument and health sector, also the efforts to strengthen the resilience of health systems as such. And that again has many dimensions, from enhancing resilience to climate change, but also to making health systems more environmentally sustainable through green procurement, through promoting and making an effort to ensure clean energy, through handling of chemicals, defined very, very widely. So there is many ways through which this voice of the health sector can and should be heard. And last but not least, luckily, health professionals in many societies are still the most trusted community, professional community. So this is also something that can be used to advocate also for measures to improve the quality of the environment to the benefit of human health. Thank you.
Thank you very much, Dorota. I see we have some comments from Maria. It's important that professionals and citizens agree and be consistent in their activities to achieve important goals. Yes, absolutely. And this is not a task for just one generation, indeed. And I would like also to hear from Violeta. So promoting health and not only curing disease is a core in prevention. And also if we link it to fossil fuels, subsidies, moving away from that and maybe pouring it into health system. Recovery and just transition obviously have to have prevention in its core program. Do we see this in fossil fuels talks, and how can we ensure that health sector brings about further these topics?
Now, if you say, do we see this when talking about things like fossil fuels and subsidies and this sort? I mean, overall, no, not enough, right? But I do think that the last probably decades has seen the narrative shift more and more, right? Just as the narrative around climate change has shifted from polar bears to people, it happened the same with all these kind of subtopics. So even when we look at fossil fuel subsidies, when we started working on this 2016, health was really nowhere to be found with relation to it, whereas now 5 years later you see the health argument coming up much more, and that idea of how that money could be spent and how we're actually fueling disease is definitely coming more to the forefront. So that's speaking of the kind of the general narrative, the media terms. Now looking actually at going forward and making all these changes happen, I mean, if you want to really assure that health is in all policies, which this comes down to, you know, we do as HEAL, for example, also recommends to create some sort of working groups that are really interministerial. So where you can have environment, health and climate at one table to really facilitate the implementation of these green agenda items, and to make sure that health is truly, everywhere, that it comes out everywhere. Now, these exchanges can also really assure that you reduce inequalities in the process. So we haven't really touched upon them much, but that's obviously a huge issue, right? How to leave no one behind in the transition, how to really make sure that we end up with a more just world than we started with, so to say. And having health at the table, having some sort of interministerial working groups would definitely bring us a step closer to that. Now, how feasible that is and what exactly needs to happen in order to get there, that's something for governments to figure out. But it would definitely add a lot of value.
Thanks a lot, Violeta. And I see some more questions for Uroš related to which energy sources could be used or are better suited than coal power plants. Well, I will take the liberty to answer this question. That coal is definitely, especially lignite coal, is the most polluting one, and science and scientists absolutely agree on that one. Whether solar and other energy sources are polluting, probably yes, and this is where we all have to come together and build the evidence and the knowledge around this, and many of this knowledge is already built, so maybe summarization of it is needed. HEAL has produced several years ago, it's called Healthy Energy paper. It's basically structured paper on which energy sources are most polluting or coming to least polluting, and which are climate polluting and health polluting. So both of those you could list there. I can post later on the link to that as well. And let me check just if we have a few more. Every form of power generator has trade-offs, exactly. Some are larger, smaller, indeed. I don't see exactly the name of the person who is posting this. And with that, I think we came really to the end of this, this webinar. And on behalf of HEAL, I would like to thank, first of all, to our excellent speakers. Really brought the topic of green agenda and linked it to the health. So really we have a strong basis now to advocate for more green agenda and healthy green agenda in Western Balkans and beyond. I would like to thank to all of the participants for their contribution to the webinar, for your questions. And again, thank you for your time and joining us in this discussion. Later on, we will be posting this video with presentations on our channel, so please stay tuned. And of course, after summer, stay tuned for our further webinars, and enjoy the rest of your day, and goodbye.